The Emory Proton Therapy Center is a 5-room treatment center located in Midtown Atlanta. We are in the process of completing our construction and should be in a position to treat patients in the fourth quarter of 2018. We know we will be the only proton therapy center in the state, and so our vision was to build the best one possible.
This is the first proton treatment center that Provident will be the owner and asset developer and manager operator of in the country. Proton therapy is an amazing modality for treating cancer in children. And when you can help treat cancer in children, it's about as satisfying an exercise or activity anyone could possibly be engaged in.
We are really delighted at Emory to have this technology. We're a comprehensive cancer center, and what we can now say is we have the full spectrum of the latest technology to treat our patients for the benefit really of patients who otherwise would have to travel great distances to have this kind of therapy.
So proton therapy is a very sophisticated form of radiation therapy. And the way that it differs from other types of radiation therapy is that we're better able to concentrate the radiation where it's supposed to go, with the least amount of radiation to things that aren't supposed to get radiation. And so the goal here is to get outstanding clinical outcomes with the fewest potential side effects.
The Cyclotron is the heart and soul of the project. It's the equipment that will generate the proton beams that will work their magic in treating the patients.
Cyclotron's produced in Germany. The weight of the cyclotron is about 90 tons. It's shipped here to the U.S. Via boat transport in this case, and then a large truck, about 210-foot truck that weighs about 200 tons with the cyclotron on it. That cyclotron will be taken out of its container. We'll swing it over the top of a hole in the top of the building, and then we'll carefully lower it down and put it on 3 pedestals in the building. So after the cyclotron's put in place, really then it's getting the electricity and the water cooling to the cyclotron. So those are the next 2 big events.
After the installation of the cyclotron, we anticipate we'll be doing consults in the next 14 to 16 months and treating patients by the end of 2018. So we now have a very defined roadmap to the end goal, which is patient treatment.
When the equipment shows up, this is something we always prepare for. Getting the building ready, having the building ready to receive the equipment. And once the equipment shows up, we're on the home stretch to get the project delivered. The building has to be delivered very precisely because the equipment is delivering such a precise treatment to the patients.
It's a very unique challenge, and you have to use mass concrete strategies because when you're pouring concrete that is upwards of 10 and 12 feet thick, the heat of hydration from the reaction within the concrete has to be managed. We had embedded sensors within the core of every pore and the surface of every pore so we could monitor the difference in temperature between the core and the surface. There's 40 miles of electrical conduit, all embedded in the concrete, 6 miles of processed chill water piping and other surfaces within the concrete. So not only do you have the challenge of pouring that much concrete, but you also have the challenge of making sure everything that's within the concrete stays intact, doesn't move, and is in the right spot because you only have one chance to get it right.
One of the other great opportunities is the medical tourism of what we're doing here. Not only does it bring a lot of high-paying, high-skilled jobs to the city, but we actually think it will bring in patients from other parts of the country and other parts of the world.
Healthcare tourism is going to be a major part of where the country and where the world is going. And it really does put a significant stake in the ground that we will have the best healthcare available certainly in the southeastern region of the United States, and to be competitive in all of America.
The reasons Invest Atlanta got involved is medical and health is a very important cluster for us, a very important focus. It helps to spur economic activity here in the city. The economic impact that this facility will have is over $500 million.
Well, I'm so excited for the future of this center and for Winship. Not only will we remain a destination for world-class cancer care, but we will continue to develop cutting-edge treatments. We have the infrastructure and the people here to continue to drive innovation and discovery to develop the latest and greatest treatments in the decades to come. What we do now is state-of-the-art, but in the future we can only get better.
Knowing the thousands of people who will have their lives saved, have their lives changed dramatically as a result of the benefits of proton treatment. That's what's exciting.